Hello, everyone, and welcome to another awesome interview on FemFusion Fitness. I am Dr. Bree, Doctor of Physical Therapy, founder of FemFusion Fitness, and I have a really fascinating guest today that I cannot wait to introduce you to. As you may know, I am really all about holistic pelvic health, so that's really the focus that I am just absolutely fascinated with and diving into these days, and that's why I really wanted to bring Kayna onto the show. I'm going to introduce her in just a moment, but we're really going to be talking about the mind-body connection as far as pelvic health, sex and sexuality, and I'm just going to let her dive into this topic. But if you have pelvic pain, pelvic tension, any type of pelvic floor dysfunction, you're going to want to listen to this interview. It's going to be really, really helpful for you. So Kayna, would you like to just say hi real quick so people can see your beautiful face?
Yes. Hi there. I'm really excited to be here. Thank you so much for having me on.
Oh, I'm thrilled. And actually, I was introduced to Kayna by my friend, Casey, who I actually organized and led a retreat in Morocco with her, a yoga and women's fitness retreat in Morocco over the last summer. It was amazing. And if you're friends with Casey, then you're friends with me. I'm so excited to connect with her. So let me just read Kayna's bio. It's a fabulous, amazing bio. So Kayna has a master's in clinical psychology and is a licensed marriage and family therapist and sex therapist. Studying for over 12 years in the fields of psychology, sexual health, and trauma treatment has enabled her to work comfortably and safely with a range of psychological challenges, which can significantly impact sex and intimacy. These challenges include depression, anxiety, trauma, grief, loss, compulsive behaviors, and life transitions. She's also a certified trauma therapist and training facilitator with the Trauma Resource Institute in Los Angeles, which provides education and training worldwide. She is acknowledged as a pelvic pain expert. Healthcare professionals, therapists, and coaches come to her from all over the world to get assistance with training and pelvic pain diagnoses. So we are very, very lucky to have her here with us today. So Kayna, I'm again thrilled you're here, and I want to just dive in with kind of the topic that may be on everybody's mind is, what is a sex therapist and what do they do?
Yeah. This is a question I get a lot because there's so much misunderstandings around what a sex therapist is. Because the first thought that comes to mind is that, like, maybe I have sex with clients, and that is like the farthest thing from what I do. I don't touch my clients.
That must be an awkward conversation. Yeah. Are we going to have sex?
Yeah. It's usually I lay the groundwork way ahead of time before they even come into my office. But usually at parties, people are like, "Oh, so you're a sex worker?" I'm like, no. That's not what I do. I'm a licensed professional. And basically what it is that in addition to the education and the training that I receive in my master's program and to become licensed, is that I seek information and education and training beyond in the sexual therapy world. And I had initially started as a sexual health educator back in 2006, learned a lot of information just about anatomy, function, sexual health, and then started to build on and realize that I wanted to go a little bit deeper with the people that I was interacting with. And so a typical therapy session, a typical sex therapy session is very similar to what somebody might think of for a talk therapy session with a marriage and family therapist or a psychotherapist. It's just that I have knowledge and can hold space for what's typically an uncomfortable conversation. And a lot of times I get clients who come, when they come to me, they're like, okay, I know that you must hear the most like bizarre, weird things that nobody's ever talked about. So I know that you can handle hearing what I have to share with you. And like 99.9% of the time, whatever they're saying, I've heard before. And so I just really like normalize it. And so we talk about everything around sex and sexuality, but we also talk about the everyday topics of like anxiety and stress management and pain management and relationship stuff, because I don't see them as separate topics. I really help people integrate their sexuality at whatever level it is into their day-to-day life and their own identity of themselves. So
that's great.
It's mostly that.
It's a very, holistic approach, mind, body, spirit. That's why I'm so glad you're here, because I know that people come to FemFusion Fitness on YouTube and they often have pelvic pain, pelvic tension, prolapse, all sorts of, issues that are there. And I can help them with posture, and I can help them with yoga and fitness and relaxing the pelvic floor and strengthening and whatever they may need physically. But really it is such a mind, body, spirit, holistic approach that really is ultimately needed. And sex and sexuality and intimacy is usually so tied into these pelvic health concerns. So do you see people with prolapse or pelvic pain, tension, postpartum issues, prenatal stress? Do you have any issues like that, women's health kind of focused issues that you deal with specifically?
Yes. So the majority of my practice and what I've come to really specialize my work in is working with women who have pelvic pain issues. So vaginismus, vulvodynia, vestibulodynia, and other pelvic floor dysfunctions as well. But that tends to be the main focus, because it was something I actually struggled with myself for about 10 years. And I didn't have any resources. So this was like 12 or 13 years ago that I started to experience pain myself. And I had to be my own advocate. I had to go out and find all of my own healthcare providers. And I was actually passed from like doctor to doctor, and nobody knew what was like going on with me. And so I took everything that I learned from that, and I really focused my practice on that, because I realized that I needed somebody like me at that time. And so I wanted to be that kind of healthcare provider that was kind of an integral part of getting them connected to resources such as pelvic floor physical therapists and gynecologists. So that's like, it's my bread and butter. It's my like near and dear place in my heart to be able to provide treatment for women who have had these pain issues and haven't really known what to do with the pain that they're having and where to go and seek information. So that's my passion.
That's great. And so you probably couldn't walk us through a typical treatment session, could you? Because I imagine everybody's very different. Or are there some common things that you do with your clients?
Right. So one of the things that I really focus on is finding an individualized treatment plan for each person, definitely. But there are some foundational things that I really like to help focus on. And first is creating safety within oneself. And we do that by exploring and understanding the nervous system. And so starting to integrate the mind-body connection. And this is where I like to get a little bit, I get a little sciencey and like nerdy almost. And I tell my clients, like, I'm going to geek out a little bit, but I think it's really important for clients to know what is going on inside of their bodies and why, because it really helps normalize their experience. For instance, like a lot of times clients express that they're really afraid, or they feel like they want to like pull away from their partner when their partner just reaches out to like hold their hand or give them a little kiss on the cheek. And I normalize that process of them wanting to pull away, because I teach them that it's actually their nervous system protecting them, because anytime that maybe their partner has come to kiss them or hold their hand or just be physically intimate with them, their brain has already registered it as leading up to sex, which leads to pain. And so I help them learn that there's a neural pathway, or just like a brain pathway, that says anything that looks like pain or sex is going to be registered as a threat to the system. So I help them understand that it's not them that's broken. It's not that they're falling out of love with their partner. It's that it's a protective mechanism. And so I help teach them and help them understand what the nervous system is for, and then how they can start to get a little bit more in control with and in conversation with their nervous system. So that's like the foundational key component to helping them build safety in themselves. And then I teach them how the second component is teaching them how to have safety with their partners, of effectively communicating, developing assertiveness. So helping them understand where they can say no, where they can ask for what they need, and how they can communicate more effectively those needs with their partners. And then the third component to the way that I work with my clients is that they find that they've had a disconnection from their sexual identity and pleasure, if they've had one at all. Maybe they haven't even had any kind of a relationship with that aspect of themselves. And so we help start to learn and understand through science and through techniques and exercises how to start to feel into a sense of neutrality first, like neutral experiences in their body, neutral emotions and thoughts around sex and sexuality, and then start to move into a sense of pleasure. Because pleasure can tend to be very scary for a lot of people, especially if they've had pain. So we just sometimes want to focus on finding pleasure. Like, let's just find what doesn't suck. Like, whatever is just not painful, let's just go there.
That makes so much sense, because that really does, that neutrality first, rather than putting on the sexy lingerie and thinking that's going to cure things. Just go to what doesn't suck first. That's fantastic. I have never heard that before. So, it sounds like, again, because this is so specific, I'm wondering, I'm kind of throwing you a curveball here, but do you think there's anything that people could do if they wanted to start this on their own? I know you offer a program, and I want to ask you about that a little bit, an online program that maybe people can reach out to you if they're interested. But is there anything that people could, if they're resonating with this, could do on their own without speaking to you first, just kind of in the meantime?
Sure. Yeah. And that's why I love doing things like this, is because there wasn't information for me out there that was free and easy and available. And so I love doing talks like this, and a big component of why I've built my work and my practice the way that I have is to be able to get that information out there as much as possible, like the basic foundational stuff. And so one of the key things that I recommend, like I said, is seeking safety within oneself. And so these ways can be done through mindfulness. Bodyfulness was actually a new term that I kind of came to here this weekend, where there's a connection to the body in a safe way that helps us find that neutrality, or at least find a pleasant sensation. Because oftentimes we find ourselves shifting to an unpleasant place. So anxiety comes up and we notice it in our chest, or we just notice our mind is like buzzing. And so I help clients just notice, okay, you might have that going on, but what else in your body do you notice? What other sensations are neutral, or maybe even pleasant? Like, are your knees neutral? Is like your earlobe, is that a neutral space? Or if for some people getting into their bodies might be difficult, it's hard, it's a new language. So I might have them experience, like, what does it feel like when I pick up this pen and I just notice the sensations of it? Like, what sensations am I experiencing? And that is a connection to the present moment that brings a sense of neutrality in our focus, as well as the unpleasant sensations. So a specific exercise is I encourage using any of the 5 senses to help them bring a presence to the present moment by picking up an orange, or like, those cuties, like the little like tangerines. Yeah. And like feel it in their hand, smell it, open it up, like listen to what it sounds like as you peel it, like wait to put it in your mouth and then put it in your mouth, and just notice all the sensations that are coming up. And what that does is it teaches the nervous system a sense of regulation. Because when the nervous system is in an anxious place or stressed, then it's in a dysregulated state. And that's where we have a lot of muscle tension, a lot of tissue inflammation, and a lot of anxiety. And so when we regulate it by utilizing the 5 senses to be in the present moment, then we help calm the nervous system down, and it can be in a space where it feels safe and connected to the present moment, and everything kind of, the system just amps down a little bit. So that's one of the things.
So I guess, so you're using an object to just ground yourself and bring yourself into the now, so that you can calm all the chatter, essentially.
Yes. Okay. Yes, exactly.
Okay.
And I think a key component that I always really emphasize, because mindfulness is one thing, but the emphasis is on noticing the sensations in the body that are neutral or pleasant. So not only bringing the present moment focus, but how does that impact me? Because that starts to build the brain pathways. And I think that's a really big component that's missing in a lot of mindfulness exercises. So I really emphasize that, of like, how's my body experiencing this sense of mindfulness?
Yeah, that's interesting. So you're learning, okay, I get this. What I'm feeling right now is I love getting people to know their bodies. Through what I do, through the work that I do. I love having them improve their body awareness, their physical body awareness of where their core muscles actually are, how it feels when you're breathing correctly, how it feels to lift correctly, how it feels to do all of these body things. But you're almost incorporating also how it feels in your mind, like the connection of like how it feels to be calm in your mind a little bit, maybe kind of a mind awareness rather than a body awareness.
Yes. And I think too, because a lot of women who've experienced some sort of difficulty in their pelvic floor and their core, that they might not even have a connection to it. And so many of us are just like living in our heads, that this is almost a step before even starting to notice the pelvic floor area or the core, that there might be such a disconnect that almost everybody understands what it feels like to have anxiety in the mind. And so it's an easier route in that most people can try to connect with. So if I have clients who I'm inviting them to notice what's happening in their pelvic floor, a lot of times I get this like blank, I have no idea. Yeah. So then we start external.
Yeah, this is amazing. And I just have, one other question here, and that's, could this be used in concert with pelvic floor physical therapy, or in concert with something like if somebody were watching my YouTube channel and doing one of my YouTube series about, pelvic tension or prolapse or something, would this be a great, thing to do in concert with a physical practice?
Yes, absolutely. And the best treatment that I see with my clients is when I partner up with pelvic floor physical therapists. So Casey is one of my really great collaborators here in Los Angeles. And I see that clients and patients who utilize sort of a wraparound treatment or a multidisciplinary treatment with a gynecologist, a pelvic floor physical therapist, and a sex therapist, the treatment is shortened, because you're working on, the pelvic floor physical therapist is working on the muscles and the physical sensation that I can't do because I can't obviously touch my clients. And then I work on, just like with muscle memory, I help train this like brain muscle memory, but also the body memory, and start working on the thoughts, the feelings, the beliefs that come up with pain that also impact the way that the body responds to a situation. So it's kind of like an even wider experience that clients have when they're working on the physical aspect, like with you, or the mental aspect that starts to train their brain to think about pain and sexuality in a different way. So yeah, it's very, very helpful in conjunction with physical therapy.
That sounds amazing. That definitely sounds like the way to go. So I love what you said, that their treatment time is generally shorter, even though they may be seeing more, practitioners with that multidisciplinary approach. It sounds great to just kind of get it all done and work everything together, so you're not having to piecemeal it all at separate times. So so I would love to hear a little bit about your program, because it sounds like people could work with you even if they're not in LA.
Yes. So in LA, I'm lucky enough to be able to have clients who we can go in like really deep and work on maybe potential traumas, and not like overt traumas, but there are little traumas that we experience all the time around like negative sexual messages and things like that. So we can go deeper, work on the trauma stuff. But I found that there was a big need to get these resources out in the rest of the world. So the program that I've developed has a few parts to it. So one part is there's educational videos that takes everything that I've learned, almost everything that I've learned about this area over the past 12 years, from a wide lens of not only mental and emotional wellness, but also physical wellness. And it puts it into some videos. So there's like video content. And then I also really want to create a sense of community, because a lot of women feel really alone in their struggle. And so there's facilitated community groups and phone calls that we can do where I provide a little bit of education, and then I'm there to help facilitate conversation around these topics with the women so they can connect and support each other, even if they're across the world. Just knowing that there's somebody else out there struggling with the same issue really helps build that sense of self-efficacy and empowerment in healing these challenges. And then the other part is personal, individual, one-on-one coaching that I can do as well with either them or them and their partner, or their partner separately as well, where it just provides some education and some guidance and treatment planning. And then also I collaborate with whoever their healthcare provider is in their local area. So if they're working with a therapist or physical therapist, a pelvic floor physical therapist, I can help collaborate with them and then help the client determine from my viewpoint, where they might want to take the next steps in regards to their pelvic health treatment. And it's just really subjective to their work. So that's that's the program.
Sounds amazing. Absolutely amazing. And I'm sure that there's a link and some resources that I can put in the show notes or the video notes. So I'll definitely
Yes.
put that in there. Do you have a link right now that you want to say, or should I just delete it or excuse me, move it to the show notes?
People can check out my website. It's kaynacassard.com. I'll definitely send you more information. My whole website and my brand is getting redone as we speak, to prepare the launching of this program. And so there are going to be some changes, but I'll give you, there's kaynacassard.com and then intuitivesensuality.com, which is the company that I founded to kind of incorporate this whole process. So yes,
okay,
just be aware.
Yeah, that's why I was wondering, because I knew that you were getting some work done on your website, getting a little facelift to your website. So I'm excited to see that. But I have to say, your current website, kaynacassard.com, is quite beautiful. I love the intuitive sensuality that it says. And when I went there and visited it, I just thought, oh, intuitive, that's such a beautiful way to describe it. I love that. I love the concept of using your intuition for how you move your body, how you live your life, how you decide what lifestyle practices work for you and don't work for you, but applying it to sexuality and sensuality is just lovely. So I'm so excited we could connect. Is there anything else that you'd want to share with my audience before we sign off?
Well, a really good point that you bring up of this intuitive sensuality. The thing I really like to part with your audience, but also just with my clients, what I help to instill is that it's something that they already have within them. It's just been covered up by a lot of different things, messages, experiences, beliefs about themselves. And so the work that I find really valuable and that my clients have really grown through is by starting to realize, oh, I have this in me. I have this sexual part in me already. I have this sensual part in me already. It's just, I've believed that I didn't have access to it. And so that's largely what I want to share, is just that it's there. There are just some things that are blocking it. And let's just kind of move through them and figure out what's going on and what's really valuable to you as a person. And that's where the sensuality and the sexuality can come up. Thank you so much for having me. I'm so glad. And I love the work that you're doing. Thank you.
Well, thank you. Well, we're all in it together. Women's health warriors together.
Yes.
This information to the people one person at a time. So thank you. And thank you everyone for watching. Please check out Kayna's information. Again, it's in the video notes below. The video description is, I guess, what it's called on YouTube. Just check below the video. So I'll sign off, everyone. See you next time. Bye, Kayna.
Bye.